Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Punjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now, I'll ask Lindsay Ascott, that is Director of Primary Care, Ministry of Health. I'll share a video with you. She's not here with us during this program, but she sent a video. She's a Director of Primary Care Quality within the Primary Care Division of Ministry of Health. Now I wish to play that video.
Thank you for the opportunity to provide opening remarks at today's Healthy Living, Healthy Heart Forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer my respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Chartered community located in Victoria. Patients as Partners believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by the motto, "Nothing about me without me." Patients as Partners has collaborated and funded iCON for over 10 years, with Dr. Kendall Ho as the executive director for all of that time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they have asked to learn more about. And today, that is about heart disease. Cardiac Services BC states that heart disease is one of the leading causes of death in Canada. However, they also state that about 90% of premature heart disease can be prevented with good health practices. Today's presenters will discuss what heart disease is, how to prevent heart disease, and most importantly, how to live well with heart disease. Resources will be provided that can empower you and your family to optimize your health. The encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on heart disease and other health topics, as well as websites where you can enroll in self-management, health coaching, and other peer support programs. These programs provide information, skills, and support to help you achieve your health goals. I want to express a big thank you to iCON and our presenters today and tomorrow. I appreciate your time and want to thank everyone for attending. What you do for your health can make a big difference. Thank you.
We are very happy today and thankful that we have 6 experts here with us today who will help us today to understand the health disease and how it affects us and how to look after yourself and your family about the basic needs and the heart disease and all that, and how can you handle it and take care of it. You can make notes as well as an issued your notepad, but toward the end you will also get a wonderful present from us that in our forum today, what points we are making and discussing. Those will be available on iCON's website, and you can Google those and search those and how you can make it better for today's life. Now I wish to invite our first Dr. Baldev Singeda, family physician. And Dr. Baldev Singeda has been practicing as a family doctor, and he will tell us how to make our life better. Dr. Singeda.
Hello everyone, welcome. My name is Dr. Baldev Singh Singeda. I'm a family doctor. Today we will talk about heart disease. Learning objectives today are what heart disease is and how you recognize the signs and symptoms, how you recognize the symptoms, what are the reasons, what we will talk about that, and along with that, how we manage the heart disease, how we treat it, we will talk about that as well. If we don't manage it, what problems or difficulties we can face later on. The heart disease, we say it in English. In Punjabi, we say it heart. We also call it a cardiovascular cardiovascular disease. There are a lot of types of this disease. It depends on the type. Yeah, what it depends where the problem is, what part of the heart structure, or we usually hear that somebody got a heart attack. Heart attack is one of the types of heart disease. All of the other types, it depends where the heart muscle is problematic, or what, or if we have problems with our arteries, the blood vessels that take blood to the heart or to the body. If there are problems in either one, so we can see here on the left side is the heart. Where I place my hand in on my chest, the heart is present there. Yeah, it's about our fist, the size of our fist. We think it's too big, but it's not good to have a big heart. Uh, it's a symptom of something wrong. But if it's too small, it's good either. And the arteries, you can see the blood vessels, small blood vessels. So if there is a clot, if it's, and then we say it's heart attack. If something like clot stuck in that, the other side you are looking at the photo. There are four. It's like four rooms. There are four parts of the heart. Two are big on the bottom. On the right side of the heart, there comes the blood that is not there is not no oxygen. On the left side, that the blood that comes there is, that's oxygenated. So the main purpose of the right side is to pump it to the lungs, and then in lungs the oxygen goes in the blood from the lungs, and then is pushed to the body parts from the right side of the heart. If you see the picture on the left side, you will see the heart muscle is little bit rigid or stiff, and then it makes the blood go in our body. And the blood vessels we are talking about, the rooms, in between the rooms there are small valves. The blood vessels, that when they are clogged, then the heart muscle cannot receive oxygen and it becomes rigid and stiff. So then the heart can stop for 3 to 4 minutes, and that's called heart attack. That if you look at the picture on the left side, the electric current starts and it goes through the mass or the muscle to the bottom of the part, and then it goes and goes upside from the sides. That's how our heart beats. If there is a problem with the current reaching on the bottom or on the sides, then it will be irregular heartbeat. If the heart muscle contracts too much or gets pressured too much, then something is wrong. If there is inflammation in the muscle or swelling in the muscle, if somebody drinks too much or there is too much stress, that could be the reason. That's called cardiomyopathy. This is one type of heart disease. The heart valves, they are present in between the rooms, you can say, that regulates the blood to go down or up. If there is a problem in the valve, if there is a problem in the valve, then there is a pressure on the heart. The heart, if they don't close properly, they should be closing properly. If they are not closing properly, then there is a problem. Sometimes they leak, that's not right either. So there will be problem with the circulation. Sometimes the valve, there is some kind of mass that get deposited on that, then there is a problem as well. You may be heard about heart failure. The heart failure means the current that goes through our heart, it should be contracting with that. If it's not properly forced, then it doesn't work. And if the current doesn't work properly and it's not contracting, and then it's irregular, and that's not good either. Sometimes you are born with it. The children are born with that heart disease because the blood vessels are not connected properly or not properly formed. And sometimes the children born with that, there is a problem with that part of the heart, and the blood doesn't flow properly through the blood vessels because they are not connected properly. What are the symptoms of the heart disease? What do you feel when you have heart disease? We usually hear that there is a chest pain. There is pain in the chest. There's the common symptom, very common symptom. We also call it angina. Sometimes when you try to exercise, try to go up the stairs, you feel chest pain. When we are in a shock or trauma, we feel chest pain. Yeah, then there could be pain in the chest. Sometimes you also have shortness of breath. Some people don't feel angina, chest pain, but they feel shortness of breath. It's not only pain in the chest. Sometimes it go up in the neck and the shoulders, and sometimes pain it could go throughout the body. There are some people, they don't feel any pain. They feel weak, they feel nauseated, they feel dizzy. So these are all the common symptoms of heart disease. If there is a heart failure, if the heart is not pumping, then there will be water in our body. These are the symptoms. Uh, these symptoms are different sometimes with men and women. They are not the same. All the books that are written so far, they are talking about the middle-aged white people. Sometimes we have seen there is a weakness in woman. She cannot play with children. She is feeling dizzy, nauseated, and then it's better to check the heart with all these symptoms. So if you feel any symptoms from these, go to your family doctor, talk to him, and ask him to check why these symptoms are happening. And uh, risk factors for heart disease, they are different. Very important is if there is the heart disease is present in our family. If somebody who's older than 50 or 55 and they got the heart disease, they should be careful in the beginning. Then they should be careful if there's a present in the family. They should be careful from the younger age. So the lifestyle, the way we live, that's very important as well. Lifestyle should be healthy. We will talk about it when we move forward. So what you eat, you should be careful. Don't No excessive use of alcohol. Um, Control your blood pressure and control your cholesterol levels. Try try to keep your cholesterol lower than 5 or 6. And take care about your sugar levels. Um, Careful about your what you eat. If we are not involved in physical activity, that's not good either. That could affect. So if we smoke, that also affects the heart. A lot of people heard about that. If you are having 2 drinks a day, then there is not a big problem. But now we have seen in the recent studies, don't drink more than 2 times in a week. That will affect your heart. If you feel any symptoms, what you should be doing? If you wanna diagnose your heart disease, talk to your doctor. Tell them to check if I got it or not, or if I have risk factors for that. When you go there, they will ask your medical history and your symptoms and medical background, and you can provide all the information. Whatever you feeling, tell him. If we need further information to provide, ask questions, and if he ask questions, you answer, and there will be tests, blood test, diabetes, cholesterol test, hemoglobin. They will check kidney function, liver function, and they will do the ECG also, like how your heart is functioning. They will check. If there is a problem in these tests, if they find out anything, then they will refer you to the heart specialist, and they will do the further testing. The additional test may include treadmill test. Uh, then they will make you run or walk on the treadmill. How long you can walk or run. Some people can't walk or run. If they can't walk, they have pain in knees or pain somewhere in the body or in the hips or in the joints. Then there will be radionuclide scan that will check your heart functioning. And if they need further testing, they will do CT scan, MRI scan. They can do to diagnose that. They will insert a dye and do these tests. And then their test is not ardiogram and the ultrasound of your heart, how it's moving, how are the valves moving, how is functioning. All these things can be checked through that test. If there is any doubt in these tests, maybe our blood vessel is clogged, then the coronary angiography is done. If they will put a tube, and then where they will insert a dye, and then they will see which blood vessel is flowing and which one is clogged. If we find out that we have a heart disease, then what should we will be doing? The first of all, make lifestyle changes, bring changes in that and manage it. Do regular exercise, 30 minutes, walk 30 minutes every day. You should be walking, and have 150 minutes of regular exercise per week. If we walk about that much amount of time, then it's good. And then the weight should be according to your height. Most of in our Punjabi, when we don't have any problem, we don't accept it until we get into the problem. In Punjabi, people, so it should be less than 3 inch. The in a woman, it should be less than 33 inch. In our culture, in our people, we should pay more attention. If you don't have a belly, it's good. But the weight should be according to your height. The other things that we should be controlling, we should quit smoking. It will only bring you diseases, nothing else. Only illness, nothing else. As I told you earlier, not more than 2 drinks in a week. You are calling the illnesses in if you are doing it more than two drinks per week. And then if we talk about the diet, eat everything but in small amounts and control the portions. We need the carbs, we need all the vegetables, we need the fruits, we need the protein. You shouldn't be stopping anything from all these four different food. The body repairs itself. If we talk about the treatment here, there are two purposes of treatment. The one is to control the symptoms of heart disease, how to manage the heart disease, and the second is that we want to stop it to be. If we want to control the symptoms, how we can control our heartbeat. Now, it shouldn't be going up or low. The both things are not correct. So there are muscles around the blood vessels. We can relax those muscles. There is a medication for blood pressure that the blood flows through our body, then it will put less pressure on the heart. If we want to reduce the risk factors, then try to lower the cholesterol levels. It depends. If you are already have heart disease and you know that your arteries are blocked, the LDL cholesterol should be from 8. If the blood vessels are not clogged and we have other symptoms present in our body, then it should be 2.0. Try to keep it low. Try to keep the low levels of cholesterol. Control your sugar intake. If you take the sugar, when we check every 3 months, see, it should be less than 7. If it's checked every 3 months, if you already have if you are already have diabetes, so every 3 months it should be checked. Keep your blood thin. Then the blood circulation will be easier, and then heart has to work less. So keep your blood thin. Take aspirin to keep it thin, ASA blood thinners. And we already talked that the heartbeat should be regular and it should be controlled. Then it will try to make the heart disease less. And if you already have and it's escalated and the blood vessels are clogged, then and there is a treatment for called angioplasty, where we put a stent and try to widen the blood vessels. That's called putting a stent to make the blood vessels wider, so that then that's the other is the surgery. Then we open the chest, and then we take the arteries from the legs and insert it in the heart.
And just in case we have a heart attack, then we should be able to, it should be our attempt to get the life back to normal as it was earlier, to get it better. Don't smoke, decrease your alcohol intake. If you already had a heart attack, you have irregular heart rhythm, then alcohol can cause swelling. And along with that, we should talk to our family how they can support us and how we can get more support. If we have a lot of stress in our life, we should try to decrease that and talk to our friend or doctor and talk to a counselor how to reduce stress or tension in our life. And we should also make better choices for eating, exercise, continue doing that. The best exercises are, as we talked earlier, 150 minutes per week walking, like a brisk walking, jogging, swimming, cycling, climbing stairs, rowing, or going up the stairs. If we have it, we should use that. And rest, whatever we do, whatever we can uh, make changes to our life to better health, we should continue doing it continuously. So remember, keeping your heart healthy not only reduces the risk of heart disease, but also benefits overall well being, activity performance, and anything you want to do, then you should be able to do it. And if you're happy, kids are getting married or whatnot, if you want to dance, you should be able to dance. You should enjoy your life. You should be able to enjoy your life. And other risks, the stroke and everything else, so you can reduce all that. And other mental problems like dementia, so you can reduce the risk of that. So try to work on it in a younger age. If you started from 15 to 25 years, your whole life will run smoothly. But if you learn about it, or you realize it later, it's sooner it's better. Thank you. There are some community resources available. They're available on HealthLink BC. You can check the website, or you can call 811, talk to a nurse, a dietitian. You can talk to them, and they're open Monday to Friday from 9 to 5. Thank you. I wish to thank Dr. Sangera, who gave us such a detailed and easy to learn information about heart diseases, about heart structure, and how to manage heart diseases. And if you have any question, please remember, if you wish to ask Dr. Sangera, write it on your notepad and pass on to our volunteers. And please, we'll try to answer all your questions, whatever you have. And people who have joined us, as Eileen told you, you can ask your questions as well. Now we'll ask our next expert speaker, who is a heart specialist, cardiologist, Dr. Tarun Sharma. I'll invite him, who has been practicing in Surrey.
Thank you. Welcome, everyone. You spared your time and came here. We will discuss some few things about heart here. I can give you more information. I thank you, Dr. Sangora, first of all, because whatever detail I was about to give, he already given. So I will tell you, I will give you some information about me. I'm a cardiologist. My name is Tarun Sharma. My office is in Surrey Memorial and Gem Pattison, and I'm a co-director there. Some patients I already meet in the hospital and some in the clinic. So today we will talk about coronary heart disease. As Dr. Sangeet already told you what is coronary heart disease. I'll give you a little bit more detail about that. First of all, our learning objectives. What is coronary artery disease? As doctors tell you, you have coronary artery disease. I'll give some details about that, and then we will talk about a heart attack. there are a lot of patients, they have problem with heart attack, and then doctors tell them that you have heart attack. So I will explain it to you what it means if you have heart attack, and then later on we will talk about what are the symptoms of heart attack in men and women, what are the difference in their symptoms. And then usually patients always ask one question: should we get the stent done or should we get the surgery done? Then we will talk about that. And in the last, I'll tell you how, that patients sometimes question that now we have stent or we have surgery done, now I won't get a heart attack. So we'll talk about that later on. First of all, what is coronary artery disease? Dr. Sugera already told you, but I'll tell you the main function of the heart is the the blood, the oxygenated blood is pumped by the heart to the rest of the body, and it travels through the blood vessels. So these blood vessels, the red one, the red blood vessel takes the blood to the whole body, to your brain, to your kidneys, the heart pumps it to the your feet, your legs, your body. And if we go to the other side, if we take same the blood vessels, we can go back to the heart. And the heart has its own blood vessels that takes blood to the heart. If there is a blockage, if there is a cholesterol or plaque, we call it coronary artery disease when there is a blockage. So these are the photos I'm showing you. These are the normal arteries. The artery that takes the blood vessel that takes the blood to the heart. If there is there is no blockage. This is, but if we don't take care of our food or don't care of ourselves, then there is a blood pressure, there is a cholesterol, then it start depositing in the blood vessels, and then other effects. If you have other illnesses, infection or other illnesses, then the cholesterol uh, start getting deposited more and more, and then the blockage is too much. Then how it affects when heart, then heart has to work more because it has to pump more with more force. So then it needs more blood, but there is a blockage, there is a plaque. So then the blood is not reaching to the heart properly, and then you start getting the symptoms of the disease. So the most common reason is, if we don't manage our cholesterol and diabetes, then it will start depositing in your blood vessels. And then your family doctor, your heart doctor, then they will tell you to the symptoms of coronary heart disease, as Dr. Sangira told you, but I'm going to repeat it again, then you will better remember it. So the most common is pain in the chest. It doesn't matter if it's on it doesn't matter if it's on the left side, it's not present, or if it's on the right side, it's there. It, it's like they feel it like there is a weight put on the chest. That's how people feel. Then they start sweating when they do exercise or do something heavy. Then there may be a heart problem. Maybe heart is not getting enough blood. That's why these symptoms start. So some people say they don't have that much pain in the not that much pain in the chest, but in the shoulders. Some people feel nauseated. Some people feel dizziness. Some people feel the shortness of breath. Some people come complain to me. A lot of people actually complain to me. As Dr. Sangeeta told, it's very common. It's very common in people. When people are getting shortness of breath, it's very common in people. Usually we check lungs. Then we also say we should test the heart as well. Sometimes people feel dizzy. Then it could be a problem in the heart. If you have all these problems, then doctor will do all the test. If there is nothing wrong in the test, then it's kind of reinsurance that you don't have the heart disease. Sometimes we hear about heart attacks, then we think about pain in chest, tightness, and we should be careful about all other things. If it's not that there will be pain in the chest, there will be other things as well that we should be careful. Like types of heart attack, we will talk about that now. I will tell you some simple things when we talk about this is normal. This is a normal heart when there is no blockage, no heart disease present. Sometimes people feel like there is a partial blockage, and then there is a problem with flowing the blood. Sometimes then you have to put a stent right away. You feel the pain when you exercise, when we do the testing. Then it means there is some blockage and some problem with the flow in the blood. If there is something wrong with the blood test and also pain in the chest, and there could be an emergency, if and go to the hospital, get a checkup done yourself. Sometimes the pain is there and it stops and it comes and goes. If it's all of the sudden severe pain in the chest and it's not stopping, that is an emergency. Then you should go to the hospital and get it checked. It could be possible that there is a problem in the blood flow, and there is a problem with the heartbeat and the blood is not reaching to the heart properly. If there is 90% blockage and 10-20% blood is flowing, non-stemming we call it. Yeah, but if you have that and then there is no emergency to fix it, there is no need to put the stent right away. But in some people, the blood just not flowing at all. It's that much blockage. If you have that kind of problem, that time your heart absolutely stops working. That's an absolute emergency. You must have heard that some people call the ambulance. Ambulance will take straight to the hospital, and then right away they did the stand. Sometimes people say that they bring us there. They admitted us for 2 days and gave us medications, and then yeah. So if there is an emergency, then an hour and a half the stent should be inserted. Sometimes if it's not an emergency, then you give the medications, you admit the patient, and then later on you insert the stents. There are other types of heart attacks too. As Dr. Sangera told you, if there is an infection then inflammation in the heart muscle also. Sometimes there is no blockage. Then the blood vessel ruptures because of infection, or could be heart attack there could be heart attack for that as well. That could be the reason too. There are other reasons of heart attack as well. So, what are the difference in symptoms in men and women? The common is pain in the chest. If there is a pain in the chest, you should see a doctor. The common symptoms will be present in both, but some symptoms are present in women, not in men, as Dr. Sangeeta told us. Some people say we only have shortness of breath, not pain in the chest. Some people will say, some women will say, I only feel, but I never have pain, but shortness of breath, and I'm sweating a lot. Sometimes there is sleep disturbance. Some people say there is unexplained fatigue. Some people say we have pain in shoulder blades. But no, I was not experiencing it before, but only today. If you have a problem, pain all of the sudden, then you should be worried. If in our family, like older people have it, and there is a problem, we shouldn't be ignoring the heart, even if there is no pain in the chest and there are other symptoms. We shouldn't be ignoring the heart. There is another thing, the heart blockage. When there is a heart attack, the heart blockage, in some women, there is no blockage. In women, when we it's called microvascular disease, there is no blockage in the big blood vessels, larger blood vessels, but in very small blood vessels there is a blockage. That's why they had pain in the chest. It's possible as well.
So in women and men, that's a difference. Sometimes there's less blockage in women. Now we will talk about what is the difference between stents and bypass surgery. As Dr. Singera explained it to you, what the stent is. I'll tell you the photo. So it will play over and over again. What we do, as I told you earlier, that all the blood vessels are connected to the heart throughout the body. Dr. Singera was explaining it to you. So from leg or arm, a tube is put in that goes toward your heart. So that tube is inserted. So as we see, you look at the tube, then you put it in there. If there's a blockage, as they're showing it here, there's a blockage, we put the tube there, and then tube has a stent. Everybody must have heard the word stunt. It's a metal fabric netting that's put in there, and that opens up your blood vessel. So any cholesterol, old cholesterol that is stuck there, it pushes away. But the risk of that is if you have a stunt and you had a 90% blockage, and it has decreased it from 90 to 20-30%. If you go it, if there's a cholesterol in the heart and you put a stent in there, so that's why it's important to take medication for cholesterol so the blockage can be removed. As your lifestyle is, how you live, you eat, and you need to change all that. That is stunt. And what is a bypass surgery? For example, an angiogram is done where they check the blood supply and heart supply and found out there's a lot of blockage. What is done there then? Then there's no possibility to put a stunt in there. We have to put a lot of stunts. More stunts we put in, the more stunts we have, more possibilities we have closing that stunt later on. So as I was explaining to you earlier, so if there's like 1 or 2 blockages, you can put the stunts in. But if you have 5, 6, 7, 8, 9, 10 blockages, it's not perfect to put more stunts in there, because there's a possibility of that stunt closing again, and it can have serious consequences. So that's why we tell them you have too much blockage. We need to do a bypass surgery. So let me show you what's bypass surgery. When you do the surgery done, they cut the chest open. So they open the chest, they go through the bone, open it, and they pull a vein out of your leg. And wherever the blockage is, let's say the blockage is here, and then you put another that vein there. The old block is still there, but you have opened up a new pathway for the blood to flow. People have this question. They said, you have bypass surgery, you must have removed the old blockages. No, we just made a new pathway for blood to flow. And there's artery in the chest. Some people say, and they say, okay, they have a cut in their leg, they pull a vein out. And some people say, they didn't do it. I didn't have a cut there. And sometimes they pull a vein and from leg. Sometimes we use an artery from the chest. So that's the difference there. So just pay attention to that. The old blockage is not going anywhere. There's a possibility of heart attack again if you don't control your cholesterol. If it is 90% and now it's 100%. So cholesterol medication is very important. And in the same manner, people ask, what are the risks? Stunt had a bypass surgery. What are my risks of having a heart attack? It's not gone to zero. You can have heart attack after surgery as well. From 70-80% blockage, it's less now. But the stunts you have, if you're not taking right medication, it can have that again. Once you have the stunts, we give you two medications for sure. One is aspirin, then that thins your blood, and the other one is it's very important to take both medications. They stop from your heart, from your blood thickening, and one we stop after a year, the other one we continue even after putting the stents in. So that's why it's important. Without discussing with your doctor, don't stop taking your medication. It's not that doctor said everything is fine, you stop it on your own. Only if your doctor tells you to stop it, you should stop. And it's not just a medication that you can cure it. You think, okay, you have this problem, you take the medication, but you need to change your lifestyle as well. You should exercise and also change your diet if you have diabetes. And if you have diabetes, then their cholesterol can increase if you don't control your sugar intake. Doesn't matter how many cholesterol medications you take. You said you eat this, you don't eat that. But even despite of that, if you don't control your sugar intake, control your blood pressure, that's also important. People who smoke, they need to stop smoking. And exercise is also very important. People usually tell me that I go for a walk, that's not an exercise. I usually tell my patients, when you go for a walk, if your heartbeat is not increasing, if you can still talk in full sentence, that means your heart is not doing any exercise. It doesn't have any side effects, but you should be doing brisk walking when you're walking or jogging. That's really important. When your heartbeat goes up, then your heart is doing some exercise. But even if you're walking, it's not bad. It has some benefits. So my final points are, first of all, you should pay attention to coronary heart disease. That is commonly due to the cholesterol blockage to blood flow to heart. So cholesterol and blood is thickening in your veins, blood vessels. Second, what should be careful about? Chest pain, tightness that you didn't have earlier. It's a possibility. that you might have a chest pain. It's not important that it's not really for sure that you have heart disease, but you should get it checked. But shortness of breath, especially when you're walking, and if you are having shortness of breath excessively, those are the common reasons for heart blockages. So talk to your doctor, and then they should send you to the heart specialist. And third is medicines and the procedures to treat heart blockages are important to reduce any symptoms. That doesn't mean your old disease is gone. You should continue to take your medicine. Thank you. Thank you very much, Dr. Sharma, who gave us such a detailed information in such a nice manner and told us about the heart shape and the blood vessels, how we can manage these issues and catch it sooner in our life and pay attention to it, and how to improve our health. Now I will invite Ajay Singh, who is a fitness instructor, and it's different from our program today. He will show us how in our daily life that we can do some movements, easy movements, to keep our health healthy and well. Ajay Singh. Everybody should stand up and move around. Right. Take deep breaths again. One arm up, put it over there, and you can do it from here, from the front or the back here, and move. Okay. Now fold the other arm. And now we'll stretch our neck a little bit, very nice and slow. Move your neck slightly one way and look down. And now very slowly move it to the other side. Now back to the other side again. And one more time to the other side. And now we'll do some hip movements. Put your hands here and widen your legs a little bit. Nice and easy, just like that. Nice and slow, slow. Good job. You're doing it very well. Do what I say. Now, in the opposite direction. You can hear some cracks from your back. If you don't do much movement, you should be doing it. Okay, 3, 2, 1, shake it. Easy. Now we'll do some exercise sitting on a chair. So you can sit on your chair. Don't relax too much. Don't sit back. If your body allows it, pick one leg and put it on other leg like this. And put one hand here and then press it down slightly. Nice and slow. In same manner, press it, bend forward a little bit, very slowly. Keep your back straight though. Come back up. Those are good sounds. It's working. It's working. One more time. Bend forward. And back up. One more time. And back up. Right. Leg down. Now put the other leg up. And slightly press it down gently. And then again, move, bend forward. Make your back straight. And up. And down again. Up. One more time. Up. Leg down. And put your hands on the side or in the front. And one leg at a time. Slightly up. Down. Up. Down. And you can do many different kind of stretches like this. One, you can keep your leg simply straight and moving it forward, and one leg totally straight. You can feel stretch back here, and then gradually move forward, touch your feet. If you can't do it, that's fine. If you can do it from here, you can go all the way here, that's fine too. Don't forget to breathe. Okay. Now, other leg straight. 3, 2, 1. Okay. Now sit straight up and arms up. This way, that way. And now the arms, bring it forward. Keep your back straight. Breathe out. And bend forward as much as you can. Try it. If your body allows it, go all the way. And back up. One more time. Nice and slow. And up. And down. One more time. Get up. Almost there. One or two times more. As we're getting older or working, we don't pay attention to our posture. Our shoulders are moving forward and back too. When you feel it like that, then roll it back. It's very simple exercise. Just roll it back. When you meet and greet each other, somebody's like this, tell them to move their shoulders back like this. The best posture is that's ideal, and your ears should be on top of your shoulder should be on top of your hip, and hip should be on top of your knees. Here. And one more time, do some jogging. And now, instead of front, we'll do it backward like this. 1, 2, 1, 2. And you can keep your arms straight. The front. 1, 2, 1, 2. Good job. Should we do it for another 10 minutes? Okay. 3, 2, 1. That's it. Do some deep breathing exercise just 5 times. Okay. Thank you very much. Did a lot of exercise. I'm hungry now. I'm gonna go eat. Thank you very much. That's it.
Thank you very much, Ajay, who to who told who let us feel fresher, better. He gave us a live example, and he let us realize healthy heart, healthy heart. Now, Dr. Sharma will tell us in detail about the structure of the heart and the heart rhythm. Okay, thank you, everyone. It's good that we all exercised. Now we all are out of our sleep, and now the exercise we have just done now. This is very important for the patients. We can do it anywhere, anytime. So, and it's very good for your health. So the exercise is very important. Now I'll talk to you about heart rhythm and some other issues that Dr. Sangeda explained to you earlier. I'll tell it in more detail. So, what are the other matters that can affect your heart? Yeah, issues about the heart rhythm. What can ruin your health? The other issues that can impact. There are questions that I told you earlier, and there are other questions that I'll talk about. First of all, the question is what issues can affect your heart? What are the other illnesses that can affect your heart? How it affects the blood supply? We already talked about that. I will tell you about this, how our heart normally beats. Because of it, it beats because of the electric signal. There is a signal that's produced in the top, and then it reaches to the bottom. As Dr. Sangera told you earlier, there are 4 parts of the heart. There are 2 up and 2 at the bottom. The bottom part of the right side Their function is to send blood to the lungs, and the function of the left part is function is to provide blood supply to the whole body. So then blood goes to the lungs, back to here, and then that's how the blood flows in your body. Because heart contracts because of the signal, the electric signal. The same signal goes right and left and then goes to the bottom of the heart. When you go to the hospital or the doctor, they tell us to do ECG. They get it done. They put the stickers on the chest, the wires, and then they check this signal. So the signal looks like this. This long line, it means your the small line is related to the upper part and the long line is to the bottom part. That means there is no fault in this one. If there is a defect in the signal in the bottom or in the center, then you will get irregular heartbeat. If there is a problem with the electric current, when it goes up and down, it's called arrhythmia. The rhythm of the electric current is not proper. What happens is then, when the signal go like this, is called arrhythmia. The upper signal is making up, but then it stops. It doesn't reach to the bottom of the heart. That's why the heartbeat is slower than the normal. Sometimes it's possible the upper signal is very much present. When the heartbeat is very small, it means very slow, it means the signal is not going down to the bottom. Then you feel dizziness, shortness of breath, people faint. Sometimes, if the signal is too much, excessive, all of a sudden there are too many signals, then you feel palpitations. If the signal is too fast, patients will feel palpitations. Yeah, the doctor will refer it to as palpitation. And then, like arrhythmia is like electric current. When there is a problem with the electric current, the most people face is called atrial fibrillation. What happens in atrial fibrillation? As Dr. Sugira told, the top part gets a signal and it suppresses it there. The upper part is not getting pressed properly. Then what happens because of that? Then it's not the problem with the blood vessels, it's problem within the heart, because the plaque starts getting deposited in the heart muscle. So the blood that's thickened there, then it becomes a clot, and then it causes a stroke. And once that clot reaches to the brain, it causes stroke. Then people can't speak. There is a problem with the mobility. The hands and legs don't work. If the clot travels and it travels through the stroke, there is a problem. It happens because of the electric current. When it happens to the patients, then the risk of stroke is more. So then we start them on the blood thinner to reduce the risk. The blood thinner, it's different than putting a stent in. The blood thinner medication is different than the stent. If there is a clot with the blood thinner, the risk of forming the clot is 70% less. That's one thing. First thing, some people say when I have a irregular heartbeat, I don't feel well because I feel it's fast or slow. Then we try to fix it. We call it irregular. Some of my patients will know cardioversion. It's called cardioversion. What it is, when we call you in the hospital, we attach a pad to the chest and then we give the electric shock. When we give the electric shock, we use it's like restarting, putting it off and then putting it on. So it's like restarting. Then the chances are the irregular arrhythmia will be cured like that with this cardioversion. Some for some people, uh, we can't even fix it with the shot because your arrhythmia is gone out of the shape. But we we can also give a medication to control this arrhythmia. Atrial fibrillation is very common illness, so there is a medication to fix it. There is another illness called heart block. What happens in this? As Dr. Sangeeta told you, the electricity doesn't travel to bottom part of the heart. It stops in the middle of the heart, and the heart is not pumping properly. It's not getting pressed properly. If there is a problem like this, we will admit you in the hospital because the electric current is not working properly. Then we insert a pacemaker. This is pacemaker. What is pacemaker? There is a wire attached to a instrument and it will fix your the electric current in your heart. It will stimulate the signals. Symptoms of heart rhythm, like I told you earlier, shortness of breath. If the heart rate is slow, people faint. If it's fast, then palpitations and sometimes pain in the chest as well. These are the symptoms of irregular arrhythmia. What can actually affect your rhythm? Heart attack could be one of them. If the high blood pressure for a long time, if you are using excessive alcohol, it could be possible because of that. Aging as well, as you grow old, it could affect your heart rhythm. So thyroid problem can also affect it. So if thyroid is up, then it can affect the heart. As I told you earlier, there are chances of stroke. You can faint with atrial fibrillation, weakened heart function as well. If there is a problem for a long time with your heart rhythm, you can get a cardiac arrest. It's different than heart attack. It's different. As you see it on the TV show, people are pressing on your heart. That's when the heart stops. Absolutely, is called. We already talked about atrial fibrillation. I will talk about heart valve problem. I will tell you in simple words. The blue blood is which there is no oxygen or less oxygen. You can see it's like a door. The valves are like a door. The and the function is open and close. so that the blood can flow in one direction. These are the doors of the heart, opening and closing their function. If there will be problem if it doesn't open, if it opens too much, there is a problem. Sometimes people faint because of that, shortness of breath, swelling in legs because of that, and weakening of heart. These are the problems faced if there is a problem with the heart valve. Then for that we do the ultrasound of the heart to test that if there is a problem with the heart valve. So they will do your ultrasound from all different parts of the heart. Some common questions that we face: people think, "Oh, my surgery is done, all the blockage is gone," but we don't remove those blocked arteries. So still you have to take care of your health. Nobody installed a stent because the blockage was only 40%. Then it shouldn't be installed. If the blockage is more, the rule is if the blockage is more than 70%, then you insert a stent. When we test is not that accurate. If it could tell the difference between 60 to 70%. As far as the testing is not showing 70% blockage, then we don't install the stent. So we don't put the stent in. The blockage shouldn't be up to 0%. If there is less than 70%, then you can take the medication and stabilize it. That's very important. The next question I usually face is putting stent is the only way to fix the blockage. First of all, I want to tell you, exercise is very important. It decreases the risk of the heart disease, and taking medication is very important. Stent and bypass surgery is not enough. Exercise is very important. Taking medication are very important. Sometimes people think the need to take medication only for a short time. The surgery is done, the stent is done, so no need to take medication. No. As I told you earlier, the stent we have put in, they will open the blockage, but the medication is still important to keep it flowing. People say, I have a smart watch and it tells me the heart rate is low. No, we can't go like that. When people are sleeping, everybody's heart rate goes slow. It doesn't mean you need a pacemaker. You talk to your family doctor, he will talk to us, and then we will decide if you really need a pacemaker. The main things I will tell you again, there could be problem because of heart valves, and then the electric current. If there is a defect in that, we fix it in different ways. So even if there is a surgery or stent, or if there is no surgery, no stent, you you control your risk factor, and then you can reduce your heart disease. Quit smoking, don't drink too much, and do the regular exercise. Thank you.
Thank you very much to Dr. Sharma. And our next session is optimizing self management and family support, which means how to self manage your health and use the resources in your neighborhood or in your community, how you can use those resources. And the speaker we have three different speakers who will come and tell us. Our first speaker is heart and stroke.
Thank you to the Intercultural Online Health Network for providing culturally tailored education and access to resources and programs for at-home self-management, and for inviting Heart and Stroke to be part of this forum. We share in their goal to help patients and caregivers optimize their quality of life by empowering them with knowledge and resources to manage heart disease. Heart and Stroke is one of Canada's leading health charities and began as a canvassing group organized by wives of cardiologists in Kingston, Ontario, over 70 years ago. We have grown to be a credible, trusted organization, and we are extremely grateful to our almost 1.5 million donors and 250,000 volunteers for their support. Over the past 7 decades, the death rate from heart disease and stroke has declined, but they are still the second leading cause of death in Canada, and there is still much more work for us to do. Many Canadians do not know enough about heart disease and stroke, and this is putting their own and their loved ones' health at risk. This is why we are so grateful to iCON for the work they do to support our cause. By raising awareness, improving prevention, saving more lives, and enhancing recovery for people living with heart disease, stroke, and vascular cognitive impairment and their caregivers, we will drive impact and improve health outcomes. Our employees serve people across Canada through research funding, providing information resources, and pushing for healthy public policy and best practices in our healthcare system. We have a robust online presence and active and engaged social media channels. As the largest non-governmental funder of heart and stroke research in Canada, we have invested more than $1.6 billion since we started our work. We are always striving to achieve the greatest health benefit for the largest number of people, and we are passionate about our cause. Despite our success, heart disease and stroke continue to take a serious toll. There are more than 3.5 million people in Canada living with heart disease and stroke, and sadly, a life is taken by these two conditions every 5 minutes. 9 in 10 people in Canada have at least one risk factor for heart conditions, stroke, and vascular cognitive impairment, but we know 80% of premature heart disease and stroke are preventable through lifestyle modification. A recent survey we did showed that many Canadians do not know enough about heart disease and what to do if faced with a serious medical emergency. I would like to take just a few minutes to quickly go over the signs of a heart attack and cardiac arrest so you are more aware of what to do. For a heart attack, if you experience any of these signs shown here, such as chest or upper body discomfort, shortness of breath, sweating, nausea, or lightheadedness, call 911 immediately or have someone call for you. Know, too, that the signs of a heart attack can be different in women. While the most common heart attack sign is chest pain, women may experience pressure or pain in the lower chest or abdomen, dizziness, upper back pressure, or extreme fatigue. A cardiac arrest is different from a heart attack. Cardiac arrest is often referred to as an electrical problem, and it means the heart has suddenly and unexpectedly stopped beating. Heart attack is often referred to as a plumbing problem of the heart. The blood flow to the heart is slowed or blocked. If someone is in a cardiac arrest, call 911 immediately. The dispatcher will send help right away and tell you to start CPR and use an AED if it's available. Signs of a cardiac arrest includes sudden collapse, unresponsive to touch and sound, and not breathing or making gasping sounds. We have information and resources available on our website for people living with heart disease, such as living with heart disease and living with heart failure. These tools provide useful information about managing chronic conditions, such as partnering with your doctor, navigating existing resources, and rehabilitation. They also can be ordered and mailed to your home at no charge. Visit our website, www.heartandstroke.ca, and click on the Heart Disease tab in the upper left corner. Scroll down to Recovery and Support. Click there and scroll again to the section called Living with Heart Disease. There you will find information on living with heart disease, taking control of your recovery, and other tools to help with your recovery. To order copies of our health information publications that can be mailed to your home at no charge, visit our website and scroll down to the very bottom, look for Patients column, and click on Health Publications. Then click on How to Order our Heart Disease Recovery to print specific chapters of our Living Well with Heart Disease book or our Living with Heart Failure book. You will also find a link to some Chinese resources. On the Chinese page, you will find a resource available in traditional Chinese on heart failure zones. We're working on one in understanding heart failure in traditional Chinese too, so stay tuned for that. We also know people who have had a stroke or heart attack need psychosocial support beyond the information and education we provide. People have told us this gap after diagnosis and during recovery and how hard it is to connect with others with similar experiences, regardless of where they live. Recognizing this, we have created and managed 2 private Facebook groups called the Community of Survivors and Care Supporters Community, where people can engage with each other and with experienced facilitators. These groups offer a safe space for people to connect, to receive peer support, learn from others, and access resources. To join, click the Heart Disease tab, go to the end of the list to Recovery and Support, scroll down to the red ribbon and click on Join Us. Then scroll down again to Community of Survivors and Care Supporters Community to join. We also engage with people with lived experience through our monthly e-newsletter called Community Connect. Through this newsletter, we provide people with lived experience with practical tips, downloadable resources, as well as opportunities to take part in research studies, surveys, focus groups, or other projects designed to enhance recovery and wellness. Thank you again for the opportunity to share who we are and how we can help. Together with you and with our partners like iCON, we are working to prevent disease, save lives, and promote recovery through research, health information, promotion, and public policy. Thank you again. Bye-bye.
You can go to the iCON website if you want to know about healthy active aging. Now we will invite who is recreation manager, Surrey, City of Surrey in Newton. Hello, everyone. I'm the manager with the City of Surrey, and I work at Newton Rec Center. I will make a short presentation. So, Surrey is age-friendly city where people enjoy lifelong activity and engagement. In a city, there are a lot of programs, forums, events. We have events in every February in Punjabi. There are a lot of speakers, doctors. There is information provided to the elderly. There are webinars every Tuesdays, City of Surrey website, workshops. There are programs in parks, Bear Creek Park, Cloverdale Athletic Park as well. You can walk in. You can go to the pool. And every year we celebrate for the Senior Week celebrations in June. There is a National Seniors Day. You can come swimming. There are fitness classes. You can find more information at the website surrey.ca/Surrey Seniors. You can find programs in Punjabi. You can also send email age friendly for seniors at surrey.ca. There are community rooms, City of Surrey parks and parks. There are 4 in Newton, 1 in Guildford, Cloverdale. There are seniors coming in. They play cards. There are social programs, and there are men and women. There is a list. There is more information present. If you want more information, you can visit. There is a number to call. Thank you very much. Thank you to many very much. You go to Surrey, City of Surrey, and then you can take benefit of any kind of classes that are offered. Our next speaker is Gunveet Sidhu, Self-Management BC. They are presenting them. Please come to the stage, Gundeep. Hello everyone and welcome. My name is Gundeep Kaur Sidhu and South Asian Cell Management. I work with South Asian Cell Management programs. In the morning sessions, Dr. Sharma, Dr. Sangeda, they explained us in detail how you change your lifestyle, how you take medications. And I'm here to discuss about those programs that are offered in BC. They are sponsored through health. You don't have to pay any fee for these programs. It's very short presentation. In this webinar, the objectives are how to self-manage chronic conditions, who's self-management BC, how you do self-management, who's self-management BC, and they provide programs, who can participate in self-management programs, who's eligible, all men or women. How these programs help people, how the people should attend these programs. There are testimonies about the outcome of the programs. So what do they think about these programs and how it helped them? So, you can attend in person. You can also work as a volunteer with us if you want to bring something to your community. So in the last, if you are interested, how to register for self management programs. Everybody told you in the earlier morning session about what are chronic conditions, what are long-term conditions. The long-term conditions are those in which you require ongoing medical care and lifestyle changes to manage and control. So that you can control, you have to self-manage. And the condition could be any. It could be heart conditions, heart disease, it could be related to the lungs, diabetes, it could be other illnesses, anything, any illness that remains more than 6 months, though for a long time, those are called chronic conditions. In these illnesses, the common problems, the common symptoms are pain, fatigue, shortness of breath, trouble sleeping, depression, fear and isolation for the worry about work and finances. We continuously lagging behind with our daily chores, and what are the services that are provided and how we can get those services. So, what is self management? With facing all these illnesses, how to manage is called self management. If you have diabetes, how you can keep it in control, how you eat, how you complete your social interactions, how you get all these skills. So you gain all these skills and then you self manage. So self management is very important. In BC, one in three British Columbians, have one or more chronic conditions. So it's very important to self manage who we are. As I told earlier, the University of Victoria Institute on Aging and Lifelong Health is a multidisciplinary research center. We train healthcare professionals how they can teach self management techniques to their patients. So our overall goal is to contribute to improving the health and quality of life with an increasing diverse population of older adults. Our satellite office is located in Delta, BC. The main focus is to screen and provide guidance. The program I'm talking about, the self-management programs I'm talking about is developed in America at Stanford University, and they are evidence-based programs. Self-management programs have been implemented in 25 countries. In self-management, BC is supported by BC Ministry of Health, patients as partner initiatives. Since 2000, our programs have been delivered in 160 communities across BC. Why we say self-management is important? You are your biggest healthcare provider. So you are the one who's taking care of yourself. So on average, we only see our healthcare professionals 6 hours per year. The rest of the time, 99% of the time, you are self managing your conditions. So now we will talk about self management programs available in BC. So our programs are free, there is no charge. There is a toolkit program, that's a self study program. What happens in there? As Dr. Sangeeta Sharma told you, risk they talked about risk factors, they talked about treatments. So all this material is combined in a one book, so you can read it on your own. That these are the symptoms I am experiencing, and so all that kind of material is combined in one book. There are programs for 6 weeks. There are workshops. You can do it online or in person. It's a 6 week program. There is a class for 2.5 hours in this program. There are programs for diabetes. We discuss different topics in there. They are about diabetes and other health conditions. Yeah, better choices, better health online. There's a self-paced program. You can log on to your computer every Monday, and you tell your program problem, and then there is a health coach program. Then there is a coach that's assigned to you. You can call once in a week for half an hour. So all of your problems you can discuss it with your coach. Then he will tell you about the strategies you can use. The main purpose to teach you how to self-manage your conditions. It's problem solving and decision making, problem solving, action planning, as is discussed in earlier session in the morning. So we should be exercising every day 30 minutes. So then the participants makes an action plan that I'm gonna use less sugar, or I will walk 150 minutes or exercise 150 minutes this week. In our sessions, there are topics covering exercise, all kind of different exercise we make them patients do. These are the topics that we cover in our workshops. These are the books. Who can participate? Any adult. Program is designed for adults 19 year plus. Available in a choice of your available in your choice of formats. Anyone with any type of chronic health conditions or pain. If you are spouse, caregiver, family member, and anyone interested in learning about self-management strategies can participate. You can also go to our website for volunteer work. The people who participated in these programs, the number of coaches we trained, how to register in this program. There is a phone number. You can visit the booth. There is a booth outside. So these were the key points of my presentation. Thank you very much.
Thank you very much, Gandeep. It's very important to self manage your care. As she explained, we go to see our doctors, but how often do we see them in a year? But you should be looking after your health yourself otherwise. But consult those specialists who are expert in this field. No. Now, the most favorite part, question and answers. Then I'll ask the speakers from this morning, ask them to come to the stage. So we'll ask them questions for answers. There are many questions that we received, but if you don't get an answer from your morning session, there's a session in the afternoon. Dr. Chima is here as well. So we can ask them those questions as well. So please don't ask those questions yet. So then you can ask them later. It will take us 30 seconds to do the setup here. Is everybody enjoying it? Are you tired? Are you hungry? People who didn't eat from home. Who didn't eat at home? Have some patience. As I said, there are many questions. I'll name the speaker, then I'll ask the question. But if anybody else want to say anything, add to it, they can do that. First question from Dr. Sharma. What's the difference between a stunt and pacemaker? Can both be put in one person? As I talked earlier, we use a stent for different conditions, and then we can put a pacemaker for different condition. If somebody had a heart attack, then stent is usually done, and otherwise it is possible to put both. Next question is, just add to that, stent are put in the blood vessels. Pacemaker is a unit outside with the wire connecting to the heart into a vessel. Next question is for Dr. Sangira. There are many questions about this topic. Stress. How does that affect our heart? How does stress affect our heart? The stress we're talking about, it affects the whole body. We don't pay much attention to mental illness. We don't want to talk among our family about these things. All the mental problems we have, it increases your heart problems, your diabetes, your nerves get tightened, so it affects your heart disease. We should all try, all our religions, either you follow Sikhism or read Bible or Quran, they are all reminding us over and over again to reduce the stress. If you win your heart, you can win the world. Reduce worry and stress. It's better to reduce it, control it. It's better for better health for whole body. Next question is for Dr. Sharma. There are many questions about cholesterol. Everybody's asking, if my cholesterol is normal, that means it's not high, do I still need to take medication for it? The doctor, Singera, talked about it. The people say, if I've been put on medication, the cholesterol level that we target, it's our attempt to keep it below that target. If it is below 1.8, then we try to be as aggressive to reduce it. So the main point is, somebody says, my cholesterol is fine. For every person, it's different. It's based on your health. If the level is fine, if a person had a heart attack, that beside cholesterol, there are other issues that we need to control. If there's a swelling, inflammation, then it's effective for that person to reduce the cholesterol medication. And when people are much older, when they're 80, 90, and they think about, the cholesterol that we have now, that you had taken it for the whole life, you reduce the risk of stroke and heart attack, then you try to reduce the medication. But when you have heart problem, you need to take it. Yes, Dr. Segura. The cholesterol hypothesis, as we were looking at the blockage earlier, the theory that came out that it's due to cholesterol, the research you're talking about, that we did some research, fine, we gave some medication for cholesterol, that it will reduce the risk of heart attack. But cholesterol is not the only reason for heart attack. But if you don't control everything, that doesn't mean if you control one thing. If you reduce your cholesterol even 1 millimole, the research is there. What you're talking about here, Sometimes people look at YouTube videos or heart track, then the doctors say cholesterol has reduced. Then they are getting wrong information. But the complete information is there are other things, with cholesterol that you need to control, that you should control as well. Uncle, let me answer your question right away. What we are listening since this morning, there are many reasons. There are many causes that increase your risk. But then you're not paying attention to the others, you're just paying attention to the cholesterol. You need to pay attention to everything. If you're talking about online media, sometime it's very minor. They make it such a big fuss about it. And Dr. Sharma and others explained, if you have high blood pressure and you're not able to control it, and then you think there's no need to control your cholesterol, but if you bring it together, you should try to do it all that. What should be cholesterol level? If I look at it, I send somebody for a test. They take the test paper, they control it for a month, and then they get the testing done. They'll see if it is fine, and then they start doing it what they were doing earlier. And then they say, my cholesterol was normal, and you didn't fix it. How did I get a heart attack? You need to have the cholesterol in check every day. It should be fine. Your sugar levels, the medication that we provide to you, it affects your body for 8 hours, 12 hours, 24 hours. If it is for 12 hours, then it's given twice a day. If it is for fact is for 24 hours, then you take it once a day. If you take it once a day, then 2-3 days you don't take it, it doesn't have that same effect. If we are telling you that it's to control, then you need to take it every day. To control your body, your illness, if you control it, then you won't face any problems in the future. If you don't control it, the problems are going to get bigger and bigger. And if you take half, and if you keep adding it, if you work as a team, you assist each other, then that can really help you in the long run. Let me ask all the questions. If we have some time later on, then we can ask those later. Next question is for Dr. Singera about blood pressure. There are many questions. They're all similar questions, so I'll just ask one or two. If you have blood pressure going up once or twice a week, then is that hypertension? If you're checking at home, how many times should we check it? How should we check it? Morning or evening? What time? And what is hypertension? So first of all, the blood pressure numbers are, if they have no other problem or illness, and there are two numbers. One is 140 and 90. It's below that. It should be below that. If you don't have any other problems or disease. If you have diabetes, and if you have heart problems or heart illness or disease, then it's tightened a little bit. As Dr. Sharma explained, if somebody has diabetes, then the bad cholesterol, it's 2.0, the target range is. But if you have that illness or disease, then it should be 1.8. Same thing with the blood pressure. If you have any other problems, then 130, it should be below 130/80. And the rest of the things, when should we check it? Try, if you don't have any worries or tension, that's fine. But if you're worried about it, then you get it checked. The more you check it, more worried you'll get it. So reduce that worry as well. You should check it according to your body, how it's reacting. and what else is happening in your life. Do it according to that. And if husband and wife are fighting with each other, then checking the blood pressure. And in the morning you get up, your body is relaxed, and your blood pressure might be normal. So those are the things you need to do at different times. And you should look, how your body is reacting to it, how it is working with it. If we eat something very salty and then check it, it goes up. But don't take it too seriously, reduce the tension. Don't worry about, your blood pressure is going up. If you check it once a week, make an appointment with the doctor, talk to them, and tell them, this is fine at this time, it's going up at this time. And the teamwork is very important. That will help us. And they said, don't worry too much, reduce the worries. How can you do that?
The next question is for Gundeep. The other question is why we should do self-manage and what it is. Why should we self-manage if the doctors are taking care of us? Why should we do it? Self-management is very important. Our health is our responsibility. My health is my responsibility. My doctor prescribed the medication. It's my responsibility to take it on time. So who's going to affect it? Me. Whose health will be ruined? Mine. So take charge of your health. It's very important. We can only do this if we understand it. Because slowly, if we are healthy, so it's not important just to be healthy, but also prevent other illnesses for a long time. So if we start changing our lifestyle, it will be affecting our health, our family. When we are ill, it affects the family. Life gets disturbed, social life gets disturbed, and along with that, we burden the healthcare system. So there is already a big problem with the healthcare system, lot of problems. So self-management is very important. How you do it? Just a small beginning. So here we were sitting down, we exercised for 15 minutes. If we do exercise 15 minutes at home, it will affect a lot of things. Blood pressure will be controlled, diabetes will be controlled, if you make it a habit. So there will be a lot of benefit. Control your meals. If you are diabetic, it doesn't mean you cannot eat sweet at all. Maybe include it in your menu and your diet menu you have made. Make the adjustments. Even with having illness, how you can control, how you can manage. That's what is taught in the self-management. How you begin it. Sometimes they will do it, just they have problem with starting it. So it's your responsibility. There are programs available and it's free of charge. So maybe you are not aware of it when you can start it and how you start it. So know yourself, tell others, ask questions, ask about education classes, ask your family where we can benefit from. It's very important to self-manage. Thank you. The next question is for Dr. Sharma. Dr. Sharma, after your session, we have lot of concerns. It's about the stress close to that. If somebody has stent or bypass, how long you can live? It won't reduce their life. The second question is, if stent or bypass, we take the artery from the leg, what will happen to the leg? It's a good question. right? Next question is, after the bypass surgery, there should be still pain present, or I'll still feel pain if I already have stents. The first question was people who have surgery or bypass or stent, how it affects life. First thing is, the surgery or stent is done because there was heart blockage. If once there is a heart blockage, the risk of heart attack is there. To decrease that, reduce that risk, we start medication. Bypass surgery or stent, we do it to improve chest pain or reduce heart attack. But if you don't control other things, other aspects, not controlling your sugar intake, cholesterol, then there will be a risk always. If you control all those things, and then your risk will be the same as the normal people. That's the answer to the first question. The second question is about the leg. When we take the vein from the leg, there are two kinds of blood vessels. There is a blood vessel that brings the blood to the body. The other blood vessels are that takes the blood back to the heart. That brings back the blood is vein. There is supply and connection is very good if we cut one, but the other veins are able to bring the blood back to the heart. There will be a cut on your leg, but when we take a longer vein, there will be a little bit of swelling on the leg, but you shouldn't worry about that. There is no need to fear that. The last question was life expectancy when the bypass surgery is done. Our main goal is your main heart related pain should be cured, and the heart attack risk we should reduce, and the risk will be reduced in the future, but it doesn't mean that your pain will be zero. Maybe there is still some blockages, but we created a new pathway for the blood flow. There could be still little bit pain after the bypass surgery. We call it stable angina. We wanted to reduce the load at the heart. We first of all we reduce the chest pain with that. I showed you. We open the chest, so we have to cut the bones. So it takes time for the bone to heal, sometimes up to a year. For some people, think that there is a kind of pricking. That is because we open the surgery. We did the surgery by opening the chest, and there is bone that is still healing. There are a lot of questions, and I'll be keep on asking about in a line. There are questions about the heart rate, resting heart rate. When you are not doing anything, that's what it means. When your heart rate is 50 to 62, when you start exercising or started running, and then it goes to 170, is it okay? The other question is around heart rate. If we check our heart rate, can we know if our pulse is irregular or is not regular? The first question is about heartbeat. How much it go up from the regular heartbeat? It depends on the age. How old are you? How healthy you are? It depends on that. Resting heart rate normally we look is around 55. Even if you are sleeping, 55 to 60 up to 65 is normal when you are sleeping, but when you are awake, sitting down, not working, not it's normal 60 to 80. When we are exercising, it depends what kind of exercise we are doing. The formula is deduct your age from 220. So if you are doing regular exercise, it should be 80% of that if a normal person. So if a person is 60, so 220 minus 60 is 160. 130, 140 if you are exercising. If there is 25-year-old person and he is working hard, he is doing vigorous exercise, it's okay if it goes above 200. It depends on the health and the age of the person. Like Ajay made us to do exercise. If you do it every day, if you do work hard, then our tolerance, we can increase our tolerance. Don't let the mic go. There is one more question for you. If you have heart disease, what side is better to sleep on, right or left or straight on your back? This is specific for you. If you have heart disease, it doesn't matter. You can sleep on either side. My guidance is don't sleep on the stomach. That's normally told. Don't. If you sleep on your back, then your neck also should be supported. If you are sleeping on stomach, sometimes the neck is tilted on either side, then you can't go into the deep sleep. The heart disease doesn't affect what side you sleep. There are two more questions. One is for Gandeep, one is Dr. Sharma. We are going over the time. After that, Ripujit will bring some information for you. Is it okay, Dr. Sangeera? Dr. Sharma told about the swelling on the leg. The advice is once your wounds are healed, we advise wear the stockings. There are special stockings, and then the inflammation and the swelling will go away slowly. Sometimes they use the stockings and then they stop using it. If you continuously wear pressure stockings, then it should be okay. Little bit problem is always there in the body. Thank you. You told. There is a specific question for you, Dr. Sharma. I hope I am reading correctly. So in Surrey Memorial, is there a coronary angiogram available instead of straight and coronary angiography? There is a one question in relation to that too. You recently heard that we had a campaign.
And we're still doing it. That we should have a cath lab in Surrey, that for stunts and all that. The patients who had stunts, if you came to Surrey Memorial, then we sent those people to Royal Columbian Hospital to put the stunts on. That's the campaign we did, that we should have it in Surrey Memorial Hospital, so people won't have to go anywhere else. They can do it in Surrey. We did the campaign for that. Where they put the stunt, they call it cath lab, so that's a cardiac arrest lab. Now we're doing fundraising. Our community has helped a lot. It's still ongoing. We are trying to have a cath lab here. So if you can build a cath lab here, that can help the patients. Somebody asked a question in that regard, how they can donate. Surrey Hospital Foundation, Surrey Memorial Hospital Foundation, if you go to their website, if you wish to donate, there are numbers there. You can call and talk to them. Then they can tell you how to donate. The second question is cath lab, CT angiogram. What's the difference? It's fine. The straight cath, we can do that procedure. You can go all the way to your thigh for the tube. If you, instead of going and doing that tube, how we can do it, it's done in Surrey Memorial. Once a CT scan, there's some waiting for that. If the wait list is more and we don't want to wait, we send for angiogram. But if you think the risk is not that high and we wish to check, but we have some time, then CT coronary angiogram is done in Surrey. Last question for Gandeep. They have campaigns. When you talk to them, you can specify which campaign you want to donate to. You have to. Thank you. I can find. Last question. Our time is done. We just have a couple minutes. For us in Punjabi, that if you have resources for self-management, for the resources in Punjabi, those are available on our website. If you go on that website and put your name down and program for diabetes and chronic disease, there's a program for 6 weeks. So with the chronic pain toolkit, that's available in Punjabi as well. And you can get the contact information from outside. You can email me directly as well. And we also have a toll-free number on website. You can talk to us. And on toll-free number, you can talk only in English. But my number, you can talk to me in Punjabi as well. That's up to you, how you wish to contact us. Thank you so much. Dr. Sharma, if you can answer in short, there are 3 arteries mainly. Then there's extra arteries called. Some people have 4, 5. I was just saying that. Stents. There are 3 main arteries. Some people have 4. They're called. There are 3 or 4 mainly for everybody. That's the first question. Said how many stunts. You can put more stunts, but our attempt is if the 3 arteries are blocked, then we do the surgery. Then if one person had a 1 stunt on, a few years later put another one, and a few years later put another one, you can put more stunts. But we don't want to put so many stunts. We want to control the stunts. And the salt you're talking about, there's no such evidence that Himalayan salt or Pakistani salt is better for blood pressure. We're just saying mainly to reduce the salt intake. I wish to thank all our speakers, Dr. Sangera, Dr. Sharma, and Gandeep as well. And from now on, we sow a seed into everybody's mind about knowledge. And they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PICS, Richmond Multi-Community Services, Self-Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Sangera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Deep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Mays. And from Ministry of Health, Ministry of Partners, and UBC as well, and Rupajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.